November is American Diabetes Month, so if you or someone you know might be suffering from some symptoms of diabetes, you'll want to stick around because we're going to learn today specifically how diabetes could affect the feet. Very important part of most of our bodies. We'll learn a little bit about some of the symptoms there and how they're treated. We're going to talk with Margaret Hewitt, who is a registered dietitian, nutritionist, and certified diabetes educator, Angie Wopat, wound care specialist, and Jen O'Loughlin, medical equipment supplies manager for Mile Bluff Medical Center, Mauston Phillips. From the Mile Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Mile Bluff Medical Center. We're learning a little bit about diabetes today. So we're joined now by Margaret Hewitt. How are you, Margaret?
Very good, thank you.
Good to have you back on the show here. So November is American Diabetes Month. And is it Diabetes Month or Diabetes Awareness Month?
You could say both.
Either one works is fine. So talk to us a little bit about what Mile Bluff is doing to recognize American Diabetes Month.
Yes, diabetes is something very prevalent throughout the U.S. and worldwide. And here at Mile Bluff, we have a couple different events going on to recognize awareness about diabetes, help people be screened for diabetes, think about preventing diabetes, and if you are diagnosed, how to prevent complications that can occur from having diabetes. So our first event, we're kicking off right on Thursday, November 1st. Angie Wopat and I, as a nurse wound care specialist, and myself as a diabetes educator, we're going to have a presentation for any community member that wants to attend called Diabetes and Your Feet.
Diabetes and your feet?
Yes.
Okay.
Yep. Yeah. Foot complications can be very common with diabetes. So we plan to give information about how to take care of your feet, demonstrate how to do a foot exam at home, have some raffle prizes, refreshments, and other diabetes support personnel too, our dietitians, pharmacists, things like that.
And you're also a registered dietitian nutritionist.
Yeah.
And that's something that's obviously very important to manage in terms of managing your diabetes, managing your diet. So very important there.
Yeah.
So let's talk a little bit about what exactly is diabetes, because we've heard of all different types. We've heard of type 1, type 2, adult onset. Like, what are the differences? What do they all mean?
Yes, yeah. So diabetes is a generic term for the many conditions that involve high blood sugar. Okay. And we often hear of type 1, type 2, gestational diabetes, and then there's some other unique forms like post-transplant induced diabetes or steroid-induced diabetes. But 1 in 11 Americans has diabetes, so you most likely know someone, neighbor, friend, family member that has diabetes. 90% of those that have diabetes are type 2, so that is more common. But even though someone has high blood sugars because they don't make as much insulin as they should, or they're not absorbing their insulin like they should, it still can be managed. So that's the important part.
Right. And how does somebody manage that? I mean, obviously, diet is important, but what else is important? What all can people do to manage their diabetes?
Yes. Diet and exercise are the foundations for helping control your blood sugars. But in addition to that, we want people to have a blood sugar meter, be tracking their blood sugar and learning what certain meals do to their blood sugars, or when they are more active or taking their medicines as prescribed, how it's helping their blood sugar. Taking diabetes medicines also can help efforts with diet and exercise, so pills or injections that are or aren't insulin definitely help to keep the numbers in a safe range.
Absolutely. And you mentioned diet and exercise as being the foundation. It's kind of interesting because it seems like that's the foundation for a lot of health-related issues and managing those issues. So what can happen to somebody if they don't properly manage their diabetes?
Yes. Unfortunately, there's many barriers why someone might not control their diabetes if they feel anger or frustration or denial that they have to deal with this. But there also can be hope and motivation where if you learn the right information, you can do a lot. And so For whatever reason, if your numbers aren't in a safe range over a period of time, those high blood sugars circulating through your veins is more like syrup. So it's very sticky, damaging your vessels.
Right.
So damage to your heart or major vessels through your heart, brain, or even the tiny vessels to the tips of your toes or your nerves, kidneys, eyes. So wherever your blood goes, if it's sticky, syrupy, it's going to be doing damage, and that's what diabetes can do if we don't try to keep our numbers in the safe range.
It leads to poor circulation for sure.
Right.
Yeah. Well, Margaret Hewitt, thank you so much for the information today. We're going to check in again with you at the end of our show. Don't go away. There is more Wisconsin Doctors coming up right after the break, so stick around. Welcome back to Wisconsin Doctors. We are here at Bluff Medical Center, and November is American Diabetes Month, so we're learning a little bit about diabetes and how it can be prevented and managed. I'm joined now by Angie Wopat, registered nurse and wound care specialist. How are you, Angie?
I'm good, thank you.
Good to have you on the program. First
Good to be here.
First time on the program. It's always good to have a newcomer. So we talked a little bit with Margaret in the last segment about foot problems. People who have diabetes often are at risk for foot problems. Now, why is that?
Diabetes damages blood vessels and peripheral nerves, especially in the lower extremities, the feet and the legs. So uncontrolled diabetes can affect the peripheral veins and the fact that they don't have feeling in their feet. They don't feel cold, they don't feel hot, they don't feel pain. So they have a lack of feeling, which is called diabetic neuropathy. So they get a sore, they develop that, and they have no feeling. It gets worse, it gets infected.
Sure.
So in the blood circulation, they have decreased blood flow. So when they develop that sore, they don't heal as fast as a normal person would heal.
Right.
So the blood flow, the decreased blood flow is called peripheral vascular disease.
Okay.
So the importance of them finding those sores and coming in is vital to them.
Absolutely.
Yeah.
And now, do the ulcers actually develop as a result of the lack of circulation or the poor circulation, or is there other factors
A mixture of
involved?
both. There's a lot of factors involved, but typically, yes, it does. They do develop because of the lack of circulation. Yes,
and then
typically.
Continue to worsen because of the lack of circulation
Yes,
as well.
yes, absolutely.
So it's estimated that about 25% of all adults in the United States who have diabetes will develop at least one diabetic foot ulcer. What are the key points to preventing this from happening?
Number one is to check your feet at least once a day.
Yeah.
Get down there. If you can look at them. If you can't, at least put your hand on there and feel.
Right.
Feel for any drainage, for any bumps. Look for any warmth, redness, any drainage. You should be wearing proper shoes that fit, keeping your feet clean, lotioning your feet, all that stuff, and proper podiatry care at least every 3 months. Seeing a podiatrist is very important.
Having the expert check it out.
Yes.
And we're going to talk a little bit about diabetic shoes in our next segment, actually. But where typically, you talked about checking your feet at least once a day. And if you can't physically look at all angles of your feet, which might be a challenge for some people, then at least feeling. So where exactly should they be feeling? Where are they most commonly occurring?
They're most commonly occurring on the fatty aspect of your foot where you put the most pressure, where you stepped on your foot.
Sure.
Sometimes on the heel, but typically right below that first great toe.
Okay.
On the plantar aspect of your foot is where you're typically finding those ulcers occurring. But they can occur anywhere on the foot. Also like to say that diabetic ulcers can occur anywhere on the lower extremity.
Sure.
We see them on the lower leg, but typically they're on the foot, located on the foot.
That's the last place that the blood reaches before it has to
Yes,
circulate
absolutely.
and go back up. So,
Absolutely,
yeah, if
yes.
it's not getting down there, that's a problem. So what signs or symptoms and we talked a little bit about, I think you mentioned maybe some discharge or something like that. What are some signs or symptoms that people should be looking for?
Yep, any warmth to your foot, the drainage, if you have a fever, the warmth, fever, drainage, anything like that, you need to call your doctor right away and get in.
Right away. This isn't something like, I'll make an appointment for next week. This is something.
No, you need to call right away. cover that wound, elevate your foot, try to relieve that pressure off of that foot,
Sure.
and call your podiatrist.
Sure. And then when they go see the podiatrist, what are the next steps that the podiatrist typically takes to treat that?
Typically, they do an assessment of that wound, and they'll consult myself, and we get a plan of care involved with that foot, and we go from there to see how extensive the wound is, and do a treatment for that foot.
Do people typically have to kind of stay off that foot for a while then until it can heal?
That is the main course of treatment, is
Yeah.
offloading. We call it offloading. We take the pressure off of that foot. That is the #1 treatment for diabetic foot ulcers, is relieving that pressure off of that foot.
So hard for us Midwesterners to stay off of our feet, especially in a rural agricultural community.
And we're very active.
We're very active. We need to make sure that we're getting the work done and while
Yep.
the sun shines.
Absolutely.
But very important to take care of ourselves as
Absolutely,
well.
yes,
yeah.
very important.
Well, Angie Wopat, thank you so much for all the information. We're going to check in with you also at the end of our show today. And there's more Wisconsin Doctors coming up right after the break, so stick around. Hey folks, welcome back to Wisconsin Doctors. We're here at Bluff Medical Center. We've been learning a little bit about diabetes, how to manage it, and a little bit on how to prevent it. We're here now with Jen O'Loughlin. How are you?
I'm doing well. How are you?
Good to have you with us. Now you are kind of our resident medical supply expert here, and you're here to talk to us a little bit about diabetic shoes. Let's talk a little bit about the differences. What makes a diabetic shoe different from a regular shoe?
Sure. So regular shoes are typically made for the average person, whereas a diabetic shoe are specifically heat molded to each individual.
Okay.
So when I see a patient for diabetic shoe needs, we have these heat molded inserts that we apply heat source to.
Okay.
Once I do that, I have them each step on to the shoe, and then we mold it directly to their feet.
Oh, wow.
And when we do that, that stops the patient from shifting and shearing and causing callus buildup
Oh, sure.
and possible ulcerations.
So that could be one of the things that kind of causes or starts an ulcer. for
Absolutely,
forming. Wow,
right.
That's interesting. I didn't realize. So these are basically custom fit soles then?
They are, absolutely, yes. That's exactly what they are.
Wow, very cool. And can you accommodate for patients with a lot of swelling, if they have a lot of swelling in their feet?
I'm glad you asked that, absolutely. We have this kind of shoe here. This is one of our best sellers because it does have a lot of give to it.
Oh, sure, yeah.
And it is extremely lightweight shoe, so it does accommodate things such as bunions or hammer toes or any other type of deformity that you might have to accommodate for.
Wow, okay, so there's some room to breathe there, which is great. Now let's talk a little bit about insurance, because a lot of people will look at this and they say, obviously this is something that I need, but will my insurance cover it? That's always a big question.
Yeah, absolutely. And of course, every insurance is different. But what I'm seeing is as long as they have a diabetic diagnosis and another qualifying condition, such as corns or calluses, ulcerative calluses, or hammer toes, something like that, some type of deformity,
Right.
most insurances are covering these.
Sure. Then how does that work? Did they go through their medical provider and they are referred to you then, and then they come to you, set up an appointment to do the fitting? How
Right.
does that work?
Yeah, that's exactly how it works. So what they need to do is meet with their primary care doc, sometimes their podiatrist.
Sure.
And when they meet with their podiatrist, they will go through to see if they even qualify. If they do qualify, we'll start the process with a prescription. With that prescription, I will go through the process of obtaining the documentation I need.
Sure.
And then we'll give them a call, have them come on in. I'll do my own foot assessment and see how we can accommodate them to best fit their needs.
Very good, very good. Very important things there. So now, how can a patient determine whether or not they qualify for diabetic shoes? I mean, do all people with diabetes really need to get diabetic shoes?
No, that's an excellent question. No, not every person with diabetes does need diabetic shoes, and that's why I would refer you to your physician. Definitely talk this over with your physician or your podiatrist and see what they recommend.
Sure. I'm curious to know a little bit more about that other shoe that you have there, because you showed us the black one that's kind of stretchy.
So we have a bunch of different shoes. As the people with diabetes are not, they're not all uniform, so everybody likes a different kind of shoe. Everybody has a different kind of need.
Sure.
This one I like a lot. It's more of a tennis shoe, and what I like about that is dexterity. So this is not a tie shoe.
Sure.
What it is called an automatic lace that's just tightened with a elastic strip. So it's nice for people with dexterity issues or arthritis. And there's so many different styles too. So I would invite you to come to the store, take a look at what we have to offer. We have quite a bit on display, and I'd be happy to talk to you about any kind of diabetic shoe needs.
Now you mentioned this shoe over here is good for people who have maybe different types of foot deformities, whether it's hammer toe or they've got issues with their diabetes or whatever. Are these shoes also good for multiple different deformities, or are there other shoes that are more catered towards one or the other?
Well, I guess I would use this shoe more for a person with a more active lifestyle. So we do have people, we're seeing people younger and younger with diabetes now, and so we want to be sure to accommodate for all kinds of lifestyles. Right. So this one I would use more for people that are into more of exercising or walking, or it's a good running shoe. This shoe is more for people, again, with deformities, things like that, people with a lot of edema or swelling in their feet.
Yeah, yeah. Lots of options for people over there. So Jen O'Loughlin, thank you so much for being with us here today. We're going to check back in with you in just a second here on Wisconsin Doctors, so don't go away. And we're back here at Mile Bluff Medical Center talking about diabetes here on our show for Wisconsin Doctors today. And the first couple of segments, we talked about what diabetes is. We talked about how diabetes affects the feet, some foot complications that some people might expect, and then how to treat those complications as well. So now we get to have everybody on and tied up in a nice, neat little package here. So, Margaret, I know that you wanted to discuss some things, some additional things that are done here in Mile Bluff that to offer community support for diabetes.
Yes, here at Mile Bluff, the first Thursday of every month at 1 o'clock, we have a small group that meets anybody in the community that has diabetes or interested in learning. It's called Passport to Healthier Living with Diabetes. So it's essentially like a support group, and if you have questions, it's a panel of myself as diabetes educator, a dietitian, pharmacist, sometimes our social worker or athletic trainer. So you can really get a lot of information if you have questions.
Sure, and that's something that people who have diabetes, or maybe they have somebody that they're concerned about and their family can go to.
Yes, and it's always held here at the hospital in one of our conference rooms.
And that Thursdays at 1 p.m. you said?
The first Thursday of every month at 1 o'clock.
At 1 p.m.
Yes.
Okay, excellent. Anything else?
The only other thing I'd say for Diabetes Month, November 21st, we have a booth outside of the cafe here about what's new in diabetes, because most people have seen a lot of commercials on new types of blood sugar meters, or continuous meters, some of the insulin pumps.
Sure.
So I'll be at that table to answer questions.
Excellent. And if people are watching right now and they may have questions, tell us a little bit about specifically how you can help and how people can get in touch with you.
Yes. So I work primarily in the main clinic here in Mauston, but I do rotate to Necedah, New Lisbon, Elroy, Delton clinics. And I'm the one diabetes educator here, and you can surely call the clinic or the hospital and ask for the diabetes educator. You could get a hold of my direct line, and if you have questions or if you'd want to set up an appointment, I see people every day for diabetes education.
Awesome. They don't have to remember your name. They just say, I want to talk to that diabetes educator I saw on TV.
Yes, yeah, that's just fine.
Angie, these are some questions that we usually start our show with, but we're ending them today. So Angie, share your role here at Mile Bluff Medical Center and how you can be contacted if people have questions.
Yes, so I am the wound care specialist here at Mile Bluff, and I work primarily at the hospital, but I also do consults at the clinic. I work with the podiatrists here at Mile Bluff, Dr. Richard Langen and Dr. Marissa McNelly. They are our two full-time podiatrists. They see patients here at Mauston, Necedah, New Lisbon, and Lake Delton. So if you have a wound, if you're already seeing them, they can see you at those clinics and here at Mauston. So I see patients inpatient and outpatient. I have a outpatient clinic here at the hospital. So
very good, very good. And then Jen, you are actually not located here you're in Mauston, but not necessarily here in the hospital. So talk to us a little bit about your role with Mile Bluff Medical Center and how people can get in touch with you.
So I am the home medical equipment supplies manager. I manage the DME portion, which stands for durable medical equipment, and that includes diabetic shoes and also glucometers. Things like that to help with diabetes. We are conveniently located on East State Street in Mauston.
Okay, very easy to find, and people can come down and check it out if they have questions for you too. And again, I think it's really important for people to know that if they have questions that they want to ask on behalf of a loved one, they can definitely call and get some education here as well.
I hope they do.
Yeah, very much so. Well, ladies, thank you so much for being here with us today. It was a pleasure talking with you.
Thank you for having us.
And that's all for our show here in Wisconsin Doctors. From all of us here at Mile Bluff Medical Center and Wisconsin's 57 Television, we invite you to live longer, live better. We'll see you next time.